Everybody, welcome to Docshala. In this series of video of NEET MDS 2021 recall, we are going to see about levels of prevention topic from the subject community dentistry. This is a very simple topic, but it is very important also. So the question they've asked from NEET MDS 2021 was, a country is taking precautions for the disease that has not yet occurred. So which of the following level of prevention is more accurate? So the options given were primordial, primary, secondary and tertiary. So these are the levels of prevention. Okay. So these are known as levels of prevention. There are 4 levels. They are primordial, primary, secondary and tertiary. So when the precautions are taken for a disease that has not yet occurred, in which category does it fall? So let us see what all these levels of prevention mean. So primordial prevention. In this, the phase of disease is underlying economic, social and environmental conditions leading to causation. So here the disease has not yet caused. So disease is not yet caused in that particular area. So the aim here will be to establish and maintain conditions that will minimize the hazards to health. Okay, so actions that we take are measures that inhibit the emergence of economic, social and environmental and behavioral conditions. So that the disease is not, what measures we take? We take measures so that the disease is not coming to that particular place. The target will be total population, so we should be careful that total population or selected groups are achieved. So how it is achieved? So it is achieved through public health policy or health promotion. So we'll take a simple example of COVID-19 and see these preventions, levels of prevention. So in primordial prevention, what did we do? Before, we have seen cases in India, like on a large scale. Before, to minimize the cases, what did we do? We put a lockdown, right? So we have put a lockdown. Now, India has achieved so much of immunity because of keeping lockdown early, right? We have seen that in the news also. So not only India, many countries have achieved so much of prevention and thing. So that is what most of the countries did in early stages. Then coming to primary prevention. So the phase of disease is, we have identified the specific causal factors that is causing this disease. Okay, the aim is to reduce the incidence of disease. That is, the aim is to reduce the amount of population that is getting affected by this disease. What we'll do? We'll go for protective measures, right? To protect the population, what we'll do, once we know the specific causal factors, we'll protect the population. So it is by personal and community efforts. So you have seen so much of awareness campaigns, awareness thing going on in for prevention of spread of COVID-19, which we did. So such as enhancing nutritional status. You remember what kind of efforts that we have taken to enhance our nutritional status and provide immunization. So in COVID-19, there was a little delay in producing the correct vaccine. But if we know the vaccine beforehand itself, we'll give immunization while primary prevention only, and eliminating the environmental risks. Okay, so target will be total population and selected groups and individuals at high risk. So high risk individuals are mostly concentrated, and of course total population is also concentrated. So it is achieved through public health programs, right? So we know, so we have seen such kind of campaigns, everything. Not like campaigns, in COVID we did virtual campaigns, virtual thing, but in normal diseases which are not such widespread, we can even do public campaigns and all to protect the to prevent further spread of the disease. Then coming to the secondary prevention, it is the early stage of disease. So it is early stage of disease. So disease has occurred in the population, but the population, the symptoms in the population are not that drastic. So when they are not that drastic, that is not life threatening, what we'll do, we'll reduce prevalence of disease by shortening its duration. So what we'll do, we'll reduce it by shortening its duration. What measures are available to, what we'll do, we'll take measures which are available to individuals and communities for early detection and prompt intervention to control disease and minimize disability. So what we'll do, we'll try to do early prevention, early detection. So we'll try to detect the disease during the early stages itself, so that the disease will not progress in the person and lead to any disability. So it is done through screening programs and all. So we'll do mass screening, everything, so that we can detect it early. So individuals with established disease achieved through early diagnosis and treatment. So individuals with established disease. So in COVID, what we did, so whenever we are seeing cases, so we have found individuals which are already contracted, and those places where they have roamed and all were locked down, and those they have contacted were also tested massively. Like if one person in a family is contacted, entire neighborhood was tested, entire apartments, entire thing was tested. So in that way, what we did, we tried to establish tried to find people with uh, early stages of disease, so that we can provide them the correct treatment at correct time and help in preventing disability or even death. So it is achieved through early diagnosis and treatment. Okay, so like this, we have screened like everywhere with the temperatures and all, we have screened, right? And we have performed massive testing was done, like in some suburbs and slums, etc. Massive testing was done so as to avoid spread of prevention and also to reduce the rate of mortality. Okay. Then tertiary prevention. Tertiary prevention is late stage of disease. So treatment and rehabilitation are the only thing which we can do. So it is to reduce number and or impact of complications. So the aim is to reduce the number that is achieving such high rate of infectivity, and also to impact the complications that are reduce the complications that are caused by the disease or is also done. Measures aimed at softening the impact of long-term disease and disability, minimize the suffering, maximizing potential years. Okay, patients, especially patients means those who have already established disease and have shown symptoms and are hospitalized for the same. So these kind of people are from we are trying to prevent, like sending out the such huge infectivity organisms into the other population also. It is achieved through rehabilitation. So like in COVID-19 we have followed a early rehabilitation procedure for those who have got admitted into the hospitals, like reduction of pro-inflammatory stages, early verticalization, autonomic balance, like multisensorial approach. So we have approached from all the segments, right? So cognitive, neurological, everything was done, so that the spread of the disease, like the way that is it is spreading is further and further like stopped. And the treatment also, we have introduced COVID cocktail injections. So this cocktail, what it did, like it has arrested the symptoms, right? It has arrested the symptoms when they are mild itself. So this was very useful for those people who had comorbid thing. It helped in preventing their uh, further degradation of health, and also it helped in maximizing their potential years of life, right? So that is what we did in COVID till now, and that is the levels of prevention that we have. So coming back to our question, a country is taking precautions for a disease that has not yet occurred. Which of the following level of prevention is more accurate? So from the discussion above, we know that the answer is primordial prevention. If you like our video, do subscribe to our YouTube channel. You can also follow us on Instagram at Dogshala for dental content and at Dogshala Medical for medical content. You can also find us on Telegram. Thank you.